Hi, I'm Dr. Kurt Woeller from the SIBO Mastery course. The title of this short presentation is called What is Small Intestine Bacterial Overgrowth? So small intestine bacterial overgrowth, abbreviated SIBO or SIBO, is a condition where larger numbers than usual of normal bacteria, normal intestinal bacteria, are found in the small intestine. Most of the bacteria in our digestive system is actually found in the large intestine. SIBO can be a cause of irritable bowel syndrome, but not all irritable bowel is SIBO related, but a lot of it is. And because of the compartmentalization of the digestive system, particularly between the small intestine and the large intestine, it's now known that each section of the bowel has its own unique normal bacteria. And if you look at the distribution of what are considered to be normal bacteria in the digestive system, there's a lot of different types of bacteria. So Bacteroides, E. coli, Klebsiella, Enterococcus are just a few examples. But when you get an overgrowth, when some of these bacteria move back into the small intestine, it can create problems. So by definition, when we have a larger amount than normal of large intestine bacteria that are finding their way into the small intestine, that by definition is small intestinal bacterial overgrowth. And the problem is that these bacteria start to ferment carbohydrates and they produce different types of gas, hydrogen gas, methane, even hydrogen sulfide gas. Now, hydrogen gas has a higher propensity to cause loose stools or diarrhea. Methane gas is more related to constipation. And when you have both gases present, you can get a mixed bowel pattern. Somebody who may have constipation on one hand, then may have loose stools another. That doesn't mean that all cases of constipation or all cases of loose stool or diarrhea are due to these gases, but in this particular condition of SIBO, that's usually the way things play out. There's a lot of different symptoms related to small intestine bacterial overgrowth: abdominal pain and cramping, mixed bowel patterns depending on what gas is most prevalent, excessive flatulence, heartburn, nausea. We even can get systemic problems: body and joint pain, headaches, skin disorders, fatigue, etc. Testing is essential. So there are what are called lactulose and or glucose SIBO tests. These are solutions that are taken that then get fermented by bacteria in the small intestine, and then we can measure hydrogen and or methane on a test to see if they're elevated. So there's a lot of different causes for small intestinal bacterial overgrowth. It can be triggered from taking acid blockers like proton pump inhibitors, Helicobacter pylori infections in the stomach, other infections that affect the digestive system as well, long-standing antibiotic use, abdominal surgery that interferes with a valve called the ileocecal valve. So there's a lot of potential triggers for this condition, and there's a lot of different types of treatments. It's not just about reducing the bacterial load in the small intestine. You have to work on other things like diet, digestion, large intestine health, intestinal motility, etc. And that becomes part of the SIBO Mastery course that I'm involved in teaching. I'm Dr. Kurt Woeller. I've been an integrative and functional medicine practitioner for over 20 plus years now. I do lab advising for Bowel Health Laboratory, do a tremendous amount of clinical education for Great Plains Laboratory. I'm a speaker, author, clinical physician, and the co-founder of Integrative Medicine Academy. Joining me in the SIBO Mastery course is my partner, Dr. Tracy Trancatella. She is well versed in digestive system disorders, autoimmune conditions, etc. She's also the co-founder of Integrative Medicine Academy. The SIBO Mastery course is a comprehensive 9-module course presented online. The material is designed for healthcare practitioners, but it's open to anybody who is interested in accessing more in-depth information about small intestinal bacterial overgrowth, testing, test interpretation, symptoms, causation, as well as comprehensive treatment and intervention. But the course also expands into other areas of chronic digestive problems where things that are known to either trigger SIBO or sort of appear like SIBO, because not all symptoms in the digestive system that are thought to be small intestinal bacterial overgrowth actually turn out to be this condition. There could be other problems, fungal overgrowth, Clostridia bacteria, parasitic infections, etc. So the SIBO Mastery course, again, very comprehensive. There are early bird discounts available, continuing education credits available. There's course exams, and then extended access to course material once the presentations of the course material have been completed. For more information about the SIBO Mastery course, you can go to SIBOmasterycourse.com. You can also email questions to SIBOmasterycourse@gmail.com. Again, this is Dr. Kurt Woeller for the SIBO Mastery course. Thank you.